Good morning, city officials. In the US, the rate of obesity has tripled within 30 years. This increase has begun to impact our youth. Currently, 30% of children are either overweight or obese. Among our Black and Hispanic communities, the rate of overweight and obese children is at 40%. The high rates of childhood obesity can be attributed to the lack of physical exercise, increased time spent watching TV, time spent playing electronics, and diets consisting of low nutrient, high fat, and sugar foods and beverages served in huge proportions. It is important that we all understand that obesity is a chronic disease. The onset of childhood obesity significantly increases the chances of living with obesity as an adult. A life spent with obesity puts an individual at greater risk of early death and developing other chronic diseases such as cancer, heart disease, and diabetes. Obesity prevention is possible. The most important aspect of obesity prevention is a lifestyle change. This lifestyle change means re-educating children and parents on what a healthy, nutritional, and well-proportioned diet looks like. Incorporating a daily minimum of 60 minutes of moderate to intense physical activity is equally as important. This lifestyle change is difficult. Many who try often lose confidence due to their lack of support and knowledge. The Let's Move campaign offers the support and knowledge children and parents need to make a permanent change. Studies show that this change shows major improvements not only in physical health but also mental health. The Let's Move campaign was designed to offer cities, towns, and counties a strategy to combat and lower childhood obesity. The program combines multiple strategies to create healthy environments, educate and guide children, as well as their parents to make better life choices. At the most basic level, the Let's Move campaign wants to ensure parents and children have the access to the necessary resources to live healthy lives. This includes, but is not limited to, offering healthier foods in schools, access to healthy and affordable food, and providing opportunities to be physically active. The Let's Move campaign is not a one-size-fits-all program. What is common in all Let's Move cities are the 5 standard goals. These goals are key targets that, when reached, children and parents will have the proper access to all resources to live a healthy lifestyle. Goal number 1, start early, start smart. As a Let's Move city, institutions such as schools, child care facilities must offer staff, children, and parents with the educational information on nutritional eating habits, ways to limit time spent on electronic devices, and how to properly incorporate physical activities into our daily lives. Goal number 2, My Plate, Your Place. Parents, caregivers, teachers, and officials must promote the concept of My Plate. My Plate is a concept that has replaced the old food pyramid. It's based off the dietary guidelines from the U.S. Department of Agriculture. What My Plate offers is easy to understand tips on what foods are in fact the most healthy, as well as their proper portion size. Goal number 3, smart servings for students. Meal programs like the School Breakfast Program and the National School Lunch Program served 11.2 million low-income children in 2014. This is a huge number of children who could have possibly been put at risk by these programs, often because these programs serve low nutritional foods that are, for the most part, full of fat and sugar. By offering nutrient-rich foods In these meal programs, millions of children will be exposed to healthy meats, grains, fruits, and vegetables. Having the support of their community increases the chances of parents and children to make an important lifestyle change, such as a total change in their diet. Goal number 4, model food service. This goal is designed to influence the private sector by showing the ability and success of offering healthy nutritional foods in city, town, and county contracted vending machines, vendors, snack shops, and concessions. Goal number 5, active kids at play. It's simple. Increase the amount of physical activity a child has on a daily basis. Officials, teachers, and parents must create an environment where physical activity is encouraged. The development of safe recreational areas is a great example of how to encourage the physical activity of children in a specific area. As I mentioned earlier, the Let's Move program is not a strict or rigid process. The goals I've mentioned are merely targets to hit on the path to reducing and preventing childhood obesity. Thank you everyone for your time.